We're going to talk now in the area of skin disorders about thermal injuries and a little bit about the clinical implications of wound care. We will have more information on wound care in other classes. This is just a little introduction to it. So, thermal injuries are burns or frostbite. You always are doing a tissue damage assessment no matter what. As a PTA, you might encounter these conditions as primary diagnoses or as comorbidities that affect treatment and planning and patient safety when you're treating the patient for something else. So, thermal injuries result from extreme temperatures, both hot and cold, and the same principles apply to burns from heat and frostbite from cold in terms of tissue damage assessment and classification. So heat-related burns can be from flames, fire, scalding from hot liquids, that's common in small children, contact burns, chemical burns, and electrical burns. Cold-related injuries are usually frostbite. It affects the integumentary system similarly to heat-related burns. Same classification system. Cold-related injuries tend to have progressive tissue damage. Burn classification is based on the depth of tissue damage rather than the causative agent. So, classification of burns, whether it's heat or cold, superficial partial thickness, it used to be called more commonly first degree burns, but superficial partial thickness involved epidermis and part of the dermis, little, if any, blister formation. So, picture like a sunburn. Deep partial thickness or second degree burns, they involve the epidermis and part of the dermis. There is blister formation. These can be really painful burns. The full thickness burn, third or fourth degree burns, involve destruction of all skin layers and often the underlying tissues. So the appearance is going to be superficial partial thickness burns are just going to be redness. Deep partial thickness burns are going to be redness with blistering, and full thickness burns are going to be either a black or white charred look, very dry. And the thing is, sometimes people say full thickness burns aren't as painful because the nerves were cauterized, basically. But anytime you have a full thickness burn, you're going to have areas around it with deep partial thickness, and those are very painful. So just keep that in mind. So there are both local and systemic effect of burns. Dehydration and edema, it's because of disruption in the circulatory system. Shock. So anytime we talk about shock, it's always inadequate perfusion of oxygenated blood for whatever reason. There are lots of different things that cause that, but in this case, it's because the blood vessels were damaged. It's damage to the circulatory system. Respiratory problems, you get some bronchoconstriction. It can cause adult respiratory distress syndrome. Pain, of course, infection because your outer layer is damaged, and increased metabolic needs during the healing period. The cells need to regenerate. So the rule of nines is a way to assess the percentage of your body that was affected by burns, your body surface area. So it's the body's divided all up into areas of 9%. So the each arm is 9%, the two of them together is 8%, your total head is 9%, 4.5% on the front, 4.5% on the back. Your trunk is 36%, 18% on the back, 18% on the front. Each leg is 18%, and the two of them together is 36%. And the perineum is 1%, so it all adds up to 100%. There is another assessment system that is used for children because their surface area is a little bit different from adults. But the rule of nines is kind of the general way to assess burns, to calculate the body area affected. So during the healing of burns, you get hypermetabolism because the cells are trying to rebuild quickly. You need to cover a clean wound to prevent infection. Healing can be a prolonged process with burns. Scar tissue develops even with skin grafting, and sometimes people, if they have really extensive burns, they don't have enough skin to graft from other areas. Physical therapy and occupational therapy are often necessary, and surgery may be necessary to release restrictive scar tissue. So during the acute phase of a thermal injury, we are our number one goal is infection control, gentle wound care, pain management considerations, and positioning to prevent contractures. So as scar tissue is forming, we don't want it to restrict joint range of motion. So careful positioning is really important. During the healing phase, we're still concerned with scar management, range of motion exercises, strengthening as appropriate, and functional mobility training. You always want to follow your facility protocols for wound care. Most larger facilities have a wound care team that involves nursing and sometimes PT and other people. So that's pretty important. You want to monitor for signs of infection and have a deep and profound respect for the patient's pain tolerance. Coordinate with the wound care team and document any skin condition changes. So, thermal injuries can have long-term functional implications requiring ongoing rehabilitation. So, that is something there. That's an area of specialty for PT. Some people are burn specialists, and some people are pediatric burn specialists. So thermal injuries are classified by depth and often require multidisciplinary care. So safety first, use standard precautions and follow facility protocols for wound care and infection control. So as a PTA, we always want to do a thorough skin assessment before we treat, modify interventions based on skin condition, communicate changes to the supervising PT, we want to educate the patient about skin protection and document. So documentation is crucial for tracking progress. So you want think about how these conditions might affect treatment planning and patient safety protocols as we talk about these different conditions. For wound care, you want to prevent problems. So regular repositioning to prevent pressure ulcers, skin inspection on every visit so you know what changed since the last visit, patient education about skin care, early intervention. So it's, for wounds, it's super important to intervene early and not let it get really bad. Assessment skills include being able to tell the difference between viable and non-viable tissue, and we'll talk more about that in your wound care class. We are going to look at different wound characteristics, signs of infection, healing progress. So PTAs can perform most wound care activities. In the state of Washington and probably in other states, you are not allowed to do sharp debridement with instrument where you cut away non-viable tissue. And in fact, PTs need to get a special training and special endorsement in order to do that as well. Always check your state practice acts if you're working in a different state and know when to refer. So your role in wound care can significantly impact patient outcomes. If you stay vigilant, document thoroughly, and communicate effectively with the healthcare team. So you can be a big cog in the machine of wound care.